So on the day of the egg retrieval, there's a lot to think about. It's really important to know that we need you to have an empty belly at the time of the egg retrieval. So during the procedure, you will be undergoing anesthesia, and that could potentially put you at risk for essentially what's called aspiration. So fluid or food that's in your belly can come up, and if you inhale that, that can be dangerous. And so that's why it's really important we tell people, usually the night before the egg retrieval procedure, usually we say starting at midnight, don't eat or drink anything after midnight up until after your egg retrieval procedure. Now, if you have an egg retrieval procedure that's potentially in the late morning or early afternoon, we don't necessarily say after midnight not to eat or drink anything. A lot of times we'll say if it's 8 hours prior to the egg retrieval, then up until that point, we'll say you can drink a little. So we'll say if you have a late morning or an early afternoon egg retrieval, we may say that you may drink fluids up until 8 hours prior to the egg retrieval procedure. This way you won't be dehydrated. Again, hydration is so incredibly important leading up to the egg retrieval procedure, so we don't want any increased risk that you will be dehydrated leading up to the egg retrieval procedure. You have to tell your doctor if you're taking certain medications that he or she may not be aware of. So some medications like aspirin, Motrin, or Aleve can increase risk of bleeding during the egg retrieval procedure. So it's really important to make sure that your doctor is aware of any of those potential medications that you're taking. Other things to make sure that your doctor is aware of is any supplements. So excessive amounts of garlic, ginkgo, or ginseng could potentially also put you at higher risk of bleeding. So you need to make sure that your doctor is aware of any potential supplements that you are taking leading up to the egg retrieval procedure. The day prior to your egg retrieval procedure, someone will call you, usually the nurse will call you and tell you what time to arrive at the surgical center prior to your egg retrieval procedure. Usually we have you arrive at least 1 hour before your egg retrieval is scheduled. Sometimes we have you arrive even earlier in particular situations, but please pay attention to what time your nurse tells you to arrive for your egg retrieval. The day prior. Now, prior to your egg retrieval, there are a number of things that happen in the surgery center. First, you're greeted by the nurse who will review your medical history with you. She will also place an intravenous catheter into your vein, which will allow us to administer IV fluids, hydration, as well as pain medication and anesthesia medication into your IV. You will also meet your anesthesiologist, who will also go over your medical history and will go over the type of anesthesia that you will be given and any risks associated with that particular anesthesia. You will have ample opportunity to speak with your nurse, speak with your anesthesiologist, as well as your physician to go over anything that you'd like to review. You will then be brought into the operating room. There you will be placed on a comfortable bed. Your anesthesiologist will start to give you medications to put you to sleep. The purpose of this is to make sure that you are comfortable and you don't move during the egg retrieval procedure. Now, once you're asleep and completely comfortable, your physician will begin the egg retrieval process. Your physician will place an ultrasound probe into the vagina attached to a very thin needle. Now, this thin needle will be placed into the vagina, into the ovaries. The needle will aspirate fluid from the follicles. So the follicles are the pockets of fluid on the ovary that contain the microscopic egg. The needle will be placed in the follicle and the fluid will be removed, and the physician will be able to see the needle draining each follicle because an ultrasound will be done at the very same time. So each follicle will have its fluid removed and placed into a test tube in the operating room. Each follicle will be drained very carefully under visualization, under ultrasound visualization. The fluid will be placed in the test tube. The fluid in the test tubes will then be handed off to the embryologist, who is sitting right nearby. So in our operating room where the egg retrieval procedure is performed, there is a window, a pass-through window, in which we can hand off each test tube containing the fluid from the follicle off to the embryologist. The embryologist will then take each tube, and as we're proceeding with the procedure, the embryologist will evaluate the fluid from the follicle and look for the eggs and identify the eggs. The physician will make sure to carefully and gently remove all of the fluid from all of the follicles in both ovaries and hand all of that fluid off to the embryologist who's sitting right nearby. After all of the fluid is removed from the follicles, the physician will evaluate the abdominal cavity on ultrasound to make sure that there is no internal bleeding. They will then remove the ultrasound probe from the vagina along with the needle, and then they'll visualize the vagina with a speculum to make sure that there is no vaginal bleeding. Again, this needle will pierce through the vaginal wall, and so there is theoretically a risk of vaginal bleeding from the needle puncture sites. And so it is very important that your physician evaluates the vagina to make sure that there is no active bleeding from those puncture sites. Once it's noted that there is no bleeding, the speculum is removed, the area is cleaned, and you're placed back into a comfortable position. It's at this point in time that your anesthesiologist will reverse your anesthesia or slow down the administration of the anesthesia medication, and you will slowly wake up from your nap. You will then be placed into the recovery room where you will continue to get IV hydration. Your vital signs will be monitored by the nurse, and you will slowly come out of your nap. You will speak with your physician, who will go over with you the number of eggs that were retrieved, and you'll have plenty of time to ask any questions that you may have. Once you're comfortable and feeling good, you will be released from the center, and somebody will take you home where you could rest for the rest of the day. So in our clinic, egg retrievals are usually performed under anesthesia. Again, the point of anesthesia is so that you are asleep and comfortable and don't feel anything during the egg retrieval. This allows us to do a good job of getting all of the fluid out of the follicles during the egg retrieval procedure. If you are asleep and comfortable, we're able to access all of the follicles that we need to get as many eggs as possible. Now, if you have only 1 or 2 follicles, it is potentially an option to have your egg retrieval performed without anesthesia. This is a very individualized conversation that you would have with your physician, but it is an option in situations where there is only 1 or 2 follicles. The entire procedure of the egg retrieval takes about 20 minutes. Now, if you have a lot of follicles, it could potentially take a little bit longer than that. If you have very few follicles, it can actually take shorter than 20 minutes. So in general, we tell people the day of the egg retrieval to take off from work. A big reason for that is because they would have undergone anesthesia and will be kind of groggy from the anesthesia. And they also may be in a little bit of discomfort. So the day of the egg retrieval, take off. The day after the egg retrieval really depends on your particular situation, and so you'd want to ask your physician specifically. In general, I tell people if they are feeling okay and they're mostly at a desk and don't have to travel very much, then theoretically they can go back to work the day after the egg retrieval. But for women who have very physically active jobs, such as postal workers or potentially nurses or teachers, they may want an additional day after the egg retrieval to be off from work. So people often ask, can you have intercourse after the egg retrieval procedure? So in general, we tell people after the egg retrieval procedure to not have intercourse for about 2 to 3 weeks. There's two main reasons for that. Number one, your ovaries after the egg retrieval are going to be enlarged. And even after the fluid is removed from the follicles, the ovary takes time to come back to its normal size. And so after the egg retrieval, because the ovaries are still enlarged for about 2 to 3 weeks, the abdomen feels full and bloated. And so intercourse can be uncomfortable for about 2 to 3 weeks after the egg retrieval procedure. Also, during the egg retrieval procedure, we place a needle in the vagina. And so there are puncture sites in the vagina that we want to heal. And so for about 2 to 3 weeks after the egg retrieval procedure, we want those puncture sites to heal. And so it's a good idea to not have intercourse during that time period while the puncture sites are healing. On the day of the egg retrieval, we usually tell people afterwards to lay low and not do very much, to kind of take it easy. On the day after the egg retrieval and the day after that, it's a good idea to walk around a bit, but we still tell people not to undergo any vigorous exercise. Number one, the ovaries are enlarged and still healing. And because they're enlarged, there actually is still a risk of ovarian torsion for about 2 weeks or so after the egg retrieval. So you need to be careful about aerobic activity. We still deter people from undergoing any aerobic activity after the egg retrieval procedure for about 2 weeks or so. But it is a good idea to get a little bit of activity after the egg retrieval procedure because we want you to try to get back to normal function sooner rather than later. Because of the needle that is placed in the vagina and the puncture sites, in order to limit infection, we tell our patients for about 2 to 3 weeks after the egg retrieval procedure to avoid jacuzzis or hot tubs. At SCRC, we are very fortunate to have our clinic right next to our state-of-the-art laboratory and surgical center. What this means is that your egg retrieval will be performed in the very same building, on the very same floor where you usually see your doctor. This is really important for convenience, safety, and workflow. And so it makes your experience better by having your egg retrieval procedure performed all in the same place.